So, Chris, thank you for joining us today. Chris Brett is a psychologist from the Northern Beaches, originally from New Zealand. He's just going to be talking to us a little bit today about his background, what therapy is like with him. So, Chris, do you want to start off and just let us know a little bit about what brought you to being a psychologist in the first place?
Yeah, sure. I think for me, in terms of as a psychologist, I originally actually studied a degree in statistics as an
Oh,
undergraduate, and yeah, interesting start, but actually quite
yeah,
applicable to psychology in the end, which
yeah,
is useful. But at that stage, I had no idea that I wanted to be a psychologist and didn't know what I wanted to be. So I went out and did a little bit of work as a statistician, and it was
yeah.
not.
But
And then
you
I
breezed
actually,
through all of your stats classes.
yes, I did breeze through my stats classes post
That's
that.
good. Unlike the rest of us.
um, so after that, I actually took a few years off and went traveling and actually lived in sort of a really remote area of Fiji for a couple of years, which was a very valuable experience. And during
Oh,
that
wow.
time, I put a lot of thought into what I wanted to do,
Yeah.
um, career at that point. And I actually put a lot of, I guess one of the main things that came to mind was that at that stage was that having been done stats, which is very sort of sitting in front of a computer,
Mm.
not engaging people much. I found that what I really wanted to do was work with people. Um,
And what was it
so
about Fiji in particular that led you to that?
I think it was just the time that I had there. I think what it was interesting insights in Fiji because um, it's obviously a very different culture they have there in terms of coming from Australia and New Zealand. I mean, my mum has lived in Australia for the last 20 years, so it's a second home to me anyway.
Yeah.
But in Fiji, I was in a very sort of rural village type area,
Hmm.
and just the village life was really quite uh, a, a contrast to the way we
Hmm.
live in Western society over here. And it was actually interesting. Something that I noticed was that their mental health was viewed very differently
Yeah,
there,
right.
and both positively and negatively, I guess. And in some ways, there was sort of there wasn't much of it that was so obvious. I think
Hmm.
people were very supported in the village lifestyle. But then, so that's kind of made sort of this is anecdotal evidence from what I observed in my early 20s. So I don't know
Yep.
how accurate it is, but this is sort of how it came across to me. Yeah, that as a broader sense, people were well supported in the community, you know.
Mm.
So within that village, everyone was well supported and felt like a part of that community. They had a belong, they had a sense that, yeah, if something was wrong, people would support them. So I think it seems like in that setting, the broader underlying incidence of mental health is less, but of
Mm.
course, there's uh, this more significant cases, and
Yeah.
that it was in the news of society, and that in those sort of situations, sort of the awareness and the insight wasn't there to support those people. So sort of it had its
Mm.
pros and cons. And I think being in Fiji and just seeing that really village mentality, working a lot, having a lot of face-to-face time with people, a lot of engagement, really hammered home to me that I wanted to work with people
Mm. Yeah.
as a and thought a lot about it. I thought about medicine. I thought about some other things. At the end of the day, I decided on psychology,
Yeah.
and that ended up doing. So I went back after 4 years away from study. I went back
Yep.
and I did my clinical psychology training. Yeah,
Here we are.
here we are. That's
And
right.
and you've kind of taken a route that is a little bit into some of the more neurobiological components of it. Do you want to talk a bit about some of the specializations or specific experience you've had through FNSD and some of the other areas? I know that you're very into EMDR. Do you want to touch on a couple of those?
Yeah, sure. So once I graduated from the program in New Zealand in 2015, I got my first job in the district health board there, so working for the public health system in a neuro rehab unit. So this
Mm.
was working with inpatients and outpatients. And yeah, it was a very valuable experience. Quite challenging in terms of the neuropsychological report writing stuff and that aspect. There's a lot to learn. You hit the ground running. But working a lot with, obviously, neuro rehab. So a lot of people had brain injuries and that sort of stuff. All sorts from strokes to TBIs and anything in between. So there was certainly an amount of PTSD involved with that as well. That's where VR training came in. So I used that a lot in that setting. Also, ACT was a pretty major modality that I used in that setting as well for people recovering. Another aspect was the functional neurological disorder, which is fascinating. And we had some really sort of cutting edge researchers in the department that I was working at. The research will just be coming out now, actually. The articles will just be published shortly on some really effective ways to treat FNSD. Fascinating. We got some really, really great results with that.
Oh, great.
Yeah.
And I imagine it might have really sharpened your diagnostic skills, because it's a skill set that it's definitely not a skill set that I have, that kind of accuracy around what might be biological and what is psychological, to the extent that you probably have. Did it change your view on kind of diagnostics or something else around the way that you treat?
Yeah, I guess so. Certainly in terms of the neuropsychological aspect, that's can be a big part of that aspect of work, is making diagnoses, because you've got the imaging from the brain, etc. You can see what's happened, and you've got your testing that you do, and does this all match up, and then you can often put that together and make a diagnosis of some form. And in terms of in that setting, making other diagnoses wasn't so pertinent in terms of mental health diagnoses. But nowadays I do quite a lot of ADHD and ASD reports, so those things are diagnostic in themselves. I guess I've bridged the gap in terms of diagnoses. I think I can see some situations it's really positive, and some situations it can be I need to think carefully about it, I think.
And you mentioned ACT, which is acceptance and commitment therapy. It's a type of mindfulness-based therapy for people that don't know all the jargon. Do you want to just explain a bit about what that approach is, and also maybe just touch on a bit about what EMDR is, which is eye movement desensitization reprocessing, just in case, so that people could get a bit of a sense of how you practice and approach treatment through those two types of treatment. I know you do lots of different ones, but I think they're the two kind of primary ones that you come to if you're looking at patients today. Is that right?
Yeah, I think, I guess everything in a sense is cognitive behavioral therapy. So always a grounding in that, and that's what we're mostly trained in as psychologists from the beginning. Then we build upon that, I guess, as we start to forge ahead in our careers. But yeah, certainly use EMDR quite a lot, following on from what I learned in the rehab unit, my therapy at the moment. And I find that a really useful approach. And kind of the idea behind that is that a lot of what happens is stems from some sort of trauma in the past. From what I've learned so far, it's most things you can trace back to a certain event that's happened. And
the other thing I like about EMDR is it can sometimes lead to some really rapid gains. I've definitely seen in some of the work I've done, and also heard from other people, especially practitioners like yourself who might have been doing it for a long time, that in a short period of time you might be able to resolve a few things, as long as you can find some of those experiences, and that sometimes they may not need to be like big traumatic experiences, but a traumatic experience that was quite unique. What's been your experience of that?
Yeah, absolutely. I think that's the thing that probably initially sold me on it the most, was that seeing how rapid some of those changes can occur sometimes, and how people can shift so much from being quite distressed from something to actually not worrying about it at all. Like literally we'll have people who rate the sort of distress as being like an 8 or 9 out of 10, and within sometimes 2 to 3 to 4 sessions can be rating that as a 0. And that's pretty astounding.
That's a pretty powerful approach.
And then within that, like the ACT side of things, that's obviously, as you said, sort of the mindfulness aspect to that. can be really beneficial in terms of the here and now type stuff. So you've obviously got the trauma that you're working on with the EMDR, but in terms of tools you can use in the current to help you deal with triggers or cope better in the current moment, it can be really useful for that. And then integrating a major aspect of ACT also is sort of goals and values focused stuff. So value stuff, what's important to you and how that informs your goals for therapy, and how that really informs treatment, can be a really useful aspect to add to it as well.
Yeah, it's a very practical therapy ACT, I think. Yeah,
it is. Yeah.
So tell me a bit about, like, what would someone expect if they were coming to see you? Like, what would therapy look like if somebody was there in the room? Maybe you're kind of beyond the first assessment session, which is lots of questions, but like, how would you describe the way that you ACT and some of the differences in the approach that you might use? Maybe you can distinguish between things that you don't tend towards, or towards because you kind of think that those things have gotten better outcomes for you over time, or something along those lines.
Yeah, I mean, yeah, each case is different, which is you got to take it on its merits. But I think going forward, after, as you say, all the initial assessments over, I guess the main sort of focus is, for me, is like what's most important. What does a lot of the evidence say is really, 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 really important in psychology is having a good rapport between clinician and client, and that means that, I guess, there's respect from both sides, and that there's trust from both sides. That's sort of something that try to work on pretty strongly from the get-go. With most people, that's sort of the baseline starting point. And yeah, once that's established, you can have a much better success, working together towards those goals collaboratively, and in a trusting relationship is what the aim is for me.
Yeah, I was just looking at the research yesterday because I wanted to see what ChatGPT said about it. So I asked it to summarize some of the more recent psychological research, and it says the same thing that it said during the training, was that all of the different approaches are in some ways equal, and what the key component is that collaborative approach and the rapport that you have. So it's a hard skill to learn. I think it's sometimes, you've got it. I think you've definitely got it from all of my interactions with you. And look, we might just leave it there. I really appreciate your time, and thanks for chatting today about your approach to therapy.
No worries. Thanks a lot, Jay. Good to see I'm in line with AI.
Thanks.